everyone, and welcome to another episode of Practical Insights into Global Medicine, where we bring you real conversations with doctors who've successfully built careers across the world. So, in today's episode, we will explore the realities of working in the UAE healthcare system, from licensing pathways and job opportunities to common misconceptions and practical tips for doctors planning to build their careers in the Gulf region. We are very happy to have Dr. Anjali with us. She's from the UAE. She's here to share her journey, experiences, and more than that, valuable insights. Dr. Anjali, thank you so much for taking time to be with us today.
Thank you, ma'am. It's absolutely my pleasure to be on the podcast wherein we can really help the community and doctors well.
So, Doctor,
That's
to start with, tell us about your journey. How did this happen from India to building your medical career in the UAE?
well, to begin with my journey, I first started from India, wherein I started my journey from Moscow to say I did my MBBS. I came to India, got my FMG registration done, got my internship, and started practicing in Mumbai with a license. And that's when there was definitely an idea to go for a bigger stage and more exposure, more diverse patient population, a healthcare system operating at a different scale entirely. And
Mm,
that's where UAE came to my mind, and with world-class infrastructure for that matter, and genuinely a global medical exposure that I got when I came to UAE. And that's when I began exploring the pathway for doctors in UAE. And that's how I
mm.
completed my Dubai licensing exam, my MOHAP, and started practicing here in the UAE.
That's really nice. I think it's a very long journey from a foreign medical graduate, practicing in India, working with, I think you worked with one of the top hospital here, and then
Yes.
moving to UAE. It's really nice to know because we come across many foreign medical graduates. We've seen different pain points, and it's really
Yeah.
nice to see that you are here now.
Absolutely my pleasure, ma'am. Thank you so much for having me here.
So, doctor, if you could go back and advise yourself before starting the licensing process, what
Hmm.
would you do differently?
So, if I tell myself, I would tell to start earlier, first of all, and treat the licensing preparation as something that begins at the moment when you feel the decision is real and not something when you get the job offer letter. Not when you have your offer letter in the hand, because that's not how it's supposed to start. For example, if I talk about one document that we have in India, that's the good standing certificate. It comes with, an expiry of 6 months. So really timing matters when each document has to be submitted. And that's the lesson I learned to know it has to be upfront. When you know it, you have to do it. So I would also tell myself to choose the target authority. Before, when I started, I never knew the target authority. So you know your target authority with an intention to start early, because each pathway follow its own rhythm, and clarity from day one saves the real time later. I would remind myself to, give the licensing exam the full respect that it deserves, because most of them have a mindset of, oh, it's a different exam. It's not something like USMLE where, everybody knows the difficulty level. But for this, you really need to know, and it's genuine professional assessment, and the preparation has to be thorough for the first time when you come to UAE. So yeah,
Hmm.
for a smoother pathway to have, I would like to remind myself to take it seriously.
So you had some support system. You already had someone in the UAE to help you guide you. Or you did it all by yourself.
No, I had to pave my own path, guide myself through, because when I started back then, there was not of much mentoring happening regarding GCC. So I had to
Mhm.
figure out my own ways, each authority. I had to learn how the system is decentralized in certain way, wherein doctor coming to each authority has to follow certain rules, criteria, fulfill certain criterias, and pass through each steps.
And doctors now understanding, let's say like you've been in UAE for more than 3 years, you've been working
Yeah.
there. So what do you feel, what is the biggest misconception doctors have about the DHA or MOHAP or DOH licensing process?
The biggest misconception that I have been also coming through is that doctors, the understanding that they have about UAE, that UAE does not operate on a single national medical license. And once that clicks to them, it becomes much more easier and clearer for that matter. System is structured by Emirates. So DHA licenses for Dubai, DOH for that matter is for Abu Dhabi and Alain, and MOHAP, that is Ministry of Health and Prevention, is for Northern Emirates. Now, Northern Emirates have five different emirates, that is Sharjah, Fujairah, Ras Al Khaimah, Al Quwain, and Ajman. But Sharjah has now have his own authority. So that's called as Sharjah Health Authority. So each has its own process, and moving between these emirates later involves their own formal pathways. So thorough verification process often is carried out across to have a successful licensing process. Also worth knowing is that these Emirates are now coming up with a unified digital platform, which has
Oh,
been
that's
developed to bring this system much more closer, which is an
mm.
exciting direction for the future doctors coming to planning to come to UAE so that they get the direction of future mobility that's going to happen in UAE.
We get this question a lot where doctors ask, can a doctor start preparing for the licensing while still working in India? Or how does the licensing process work?
Absolutely. That's one of the favorite advice that has become from my side is that because it makes such a difference, doctors can begin nearly everything while still practicing in India. Opening, having their data flow verification started, requesting for a good standing certificate, getting their degrees transcript attested, preparing for the exam, final licensing activation. Typically, everything can be done while the candidate or doctor is basically in India. And by that time, they can also be aligning and securing a job offer. But there is no reason as such where the groundwork cannot begin well before that.
Many doctors connecting with us, they get confused in terms of documentation because we
Yeah,
understand Middle East is quite massive, right? UAE
yeah.
requires something different, Saudi requires something different, Kuwait is different, Oman is different, Bahrain is different. So if you have to advise doctors, like what document should every doctor prepare early to avoid unnecessary delays?
So I would always encourage doctors to build a complete licensing folder early. So the primary medical degrees, their full academic transcripts, or mark sheets for that matter, the higher secondary or the 12th grade certificates, which is genuinely required. But it is easy to be overlooked. But over the period of time, you really require it. The good standing certificate, the home country license, your experience letters, your internship, your valid passport, and often for, not to forget, for specialists for that matter, properly typed official logbooks, stamped logbooks for that matter are really, really important. So doctors who prepare these folders, it is really, for them, it's early move through process and smoothly. So with this, they can have the real momentum in getting their entire licensing framework done.
And now this comes and the most burning question, because now we know when we talk about global options, whether it is UK or whether it is Australia or whether it is New Zealand or Canada, we know
Yeah,
every country has become extremely competitive. Things are no more like how it was before. Like
yeah,
earlier, you passed the licensing exams. We've seen those beautiful times in 2018,
yeah,
19, 20, where you just pass the licensing exams and you have a guaranteed job offer, whether
yeah.
it could be club or aims, but now the situation is not that, it's highly competitive. So how competitive is the UAE job market today? Like, let's say, as you said, doctors will invest all the time over here preparing for the licensing exams, doing their data
Mm,
flow, getting their all the work done, but are
mm.
there jobs, or how competitive is the job market?
So, with
Mm.
strong opportunities, particularly for doctors, but only the doctors who bring in specializations of both certifications. Of course, general practice roles have seen much more applicants than they once did before, which simply means that the doctor coming to UAE or anywhere in the Middle East has to invest in differentiation, additional certification, or a clear niche that will move faster.
But as doctors said, so it's good, the market is there. Like, as it's dynamic
Yes,
market, I think jobs keep coming. Right.
absolutely. There are a lot of clinics opening up. There are a lot of hospital expansions happening. So the roles for GP, for specialists, are growing tremendously in UAE.
They do.
Yeah.
So, doctor, now we just spoke about the job market.
Mm.
Just for the audience understanding, can you tell us a little bit more in details as an international medical graduate? If I want to get into training in UAE, what exam should I give? And how different is it from DHA?
So there are two pathways here that I will be telling you. So first thing is if you want to get in training, that's more of like a post graduation, just like how we have NEET PGs in India. In
Mhm.
UAE, you have an Emirates medical licensing exam. So that's called as MD. It's a residency exam basically for post-graduation. And licensing exam on that matter is clearly on the basis of the title that you hold. And that again depends on the degree that you hold. Like a GP doctor will have an MBBS degree, a specialist doctor will be having an MD, DNB, MCH
Mm.
for that matter, and consultant and so on and so forth.
Doctor, how, on an average, how long does it take for an international doctor to secure their first job in UAE?
So it varies, and honestly, the biggest factor here is how prepared the doctor's licensing has been before. So
Mhm.
that's when they start their job search. So doctors who arrive with their eligibility, they're already well underway, consistently moving faster, often
Mhm.
within a few months once the documentation is clean. And the doctor who begins licensing and job search together in parallel tend to have like a smoothest overall timeline. It all depends on how faster and how complete your licensing framework is for you to submit and start for the job search.
I understand that the eligibility letter is valid
Mm.
for 1 year, right? Let's
Yeah.
say, in the worst scenario, if a
Mm.
doctor does not secure a job in that 1 year,
Mm.
does he have to repeat the exam again and go through the whole process, or how does it work?
No. So yeah, there are candidates with this confusion, but to be honest, you do not have to go through the exam again.
Mhm.
Eligibility letter can be renewed within a year with the same amount that you paid to apply for it. You can renew it with the same amount. So you do not have to give exam for the next 5 years at least because your exam stays valid for that time.
And because you did mention in one of the previous question that of course jobs are there, but you need to stand out. That's what we
Yes.
mentioned, right? So what qualities will help one candidate stand out from or stand out over another with similar qualifications?
So few things that consistently have made real difference is already holding an active license or being well into an eligibility process. Board certification or tier one training such as FRCS, MRCP, US board, recent or continuous of clinical practice, and a complete well-prepared documentation. So having a strong English or Arabic for that matter, there are many doctors who have Arabic command as well, which is relevant and along it goes a long way in the interviews and day-to-day practice. So candidate like this, they do have a real difference when they look after.
Now, because you spoke about Arabic, let's say if someone invests time and learn Arabic and add that on the CV, will that help a little bit in boosting the
Yeah, but it is not a mandatory criteria to have it because learning Arabic, getting into a newer language when you're already clinical practicing is not sometimes possible, but some doctors really tend to do it because they genuinely interestingly do it. But yes, if you do have it, there are clinics that preferably will have certain criteria wherein UAE Arabic language preferred. Speaking Arabic language is preferred.
So, have you learned Arabic, doctor?
I haven't really, but we know few of the words because we need to communicate with them. But
Mhm.
they are all very familiar with English for that matter. And a Western trained doctor is something that really awes everyone in the room. So
Mm.
that's how we stand out here.
And which specialties are currently seeing the highest demand across the UAE? Because we do get many specialists connecting with us. You know, I've done this specialty. Is there scope for this specialty? Are there jobs for this specialty?
Absolutely. So there are anesthesiology, for that matter, radiology, emergency medicine that remain consistently strong here. So orthopedic, for that matter, orthopedic surgery, cardiology, oncology, they're also seeing a robust demand. And then two exciting growth areas worth highlighting as are basically surgeries, fertility treatments, and something with digital health, which are opening entirely newer categories and opportunities in UAE.
So, Doctor, no, I think about UAE's salary, you can certainly go to GooCampusWorld.com. We have a salary calculator tool over there, which will give you all the information in terms of your salary saving. You can check through. Now, let's say beyond salary, because salary numbers, so most of them will get it online.
Yeah.
What benefits should every doctor negotiate? Because what we've seen is Middle East is tax free. You have air tickets, accommodation, so many things we get to hear.
Yes. So I'll always encourage doctors to look at the full package, correct? For example, certain hospitals,
Mhm,
they do give you housing allowance or accommodation, or maybe a
mhm,
transport support. annual flights at home, family visas, or maybe schooling support for those who are relocating with dependents, full scope of health insurance coverage. Sometimes they also come up with CME or CPD points for that matter. And also
Mm.
for consultants and specialists, there are golden visas opportunities and sponsorship supports too,
Oh.
which are
Mm.
increasingly part of, strong offers. So I would always recommend doctors to make sure that you go through all these benefits and make sure that you ask for it.
Good to know. I mean, a lot of doctors do ask this in community as well. Plus, when they
Yeah.
call, they ask, is it better to secure a job first or complete the licensing first? Because I think some Emirates have different process. No, I think that's how they get confused.
Yes, yes. So I think it's all about sequencing rather than either or here, correct? So
Mm-hmm.
the final license activation generally aligns with the job offer. That's true. But everything leading up to that, for example, verification, examination, eligibility, it's best started well before the job search begins. So doctors who arrive at the job market are already eligibility ready and present themselves immediately deployable. So which is like genuine advantage for them to secure the job very easily.
True. I think some doctors feel that they should start trying for a job. If the job happens, then they will start the licensing process. I
Correct.
think when they're not ready, so they lose the opportunity.
Correct.
Because hospitals will not wait for so many months, I guess. They want someone who's ready to be hired.
They really want the paper to see. They really want the paper. If you have the paper, they'll just your license and you can start your work.
And because we're speaking about jobs and we cannot skip this question, so should doctors rely on recruitment agencies or apply directly to hospitals or use both? What do you recommend, doctor?
So according to me, it should be both, but used thoughtfully. So like direct applications will work beautifully when a doctor has specific hospital group or system in mind. Correct?
Mm-hmm.
Agencies, they really add values in navigating the licensing paperwork, surfacing the roles that aren't publicly advertised. My advice is simply to choose some professional help where with a strong, verifiable track record. The right partner will actually make a meaningful difference in their entire job search journey.
Okay. So let's say they have to look for hospital websites, try there. Plus, if possible, if you're able to do your own research and figure out a verified job agency, that is still a plus.
Correct.
And of course, as you said, the job portals. I think you just mentioned in one of our webinars about LinkedIn, Bait, and other websites. I guess these job portals, right? And what we've heard
Absolutely.
is I don't know whether it's true or not true. Networking matters a lot. If there's already a doctor working in the particular department, if they just refer you, you can get a job faster. Is that true?
Absolutely true. One thing that I've learned coming to UA is all about networking. How you present yourself, how you conduct yourself, how you network yourself, and how you maintain it. Because end of the day, everything here works on networking. So even if
Okay.
it's a hiring position or internally, for example, there is an opening internally and you are already networked with one of the recruiters or for HR for that matter in some or the other place or maybe in webinar or in an expo, somehow that person can really link you to that job. And that's how it works here.
Oh,
It's all really genuinely about networking. And of course, as you said, the platforms. LinkedIn, for that matter, has given a lot of importance, has been given a lot of importance here in UAE. Gulf talent for that matter, Naukri Gulf. There are many job opportunities coming up. But again, doctors are supposed to be very, very aware to not fall prey to the scams or anything coming up. So be vigilant in understanding that you are calling up to the right person or maybe not fallen prey to paying certain amount for the
okay.
agencies.
So now, doctor, because you've seen, I think so many of your juniors or so many of your friends, I'm sure they'll be connecting with you, asking about the licensing process. So, what are the biggest mistakes doctors make during the licensing process?
So what I have seen so far is, first of all, the mistake that they made is not having proper documentation work. Uploading a
Mm-hmm.
document with not clear dates, names, specific departments, not having it stamped, the good standing certificate is not mentioned. The internship certificate is something that is usually skipped because on the portal, there is no clear section for internship certificate. And that's when the candidate misses the document. And once the report come in and they apply for the letter, they are rejected by the DHA portal because the report has no internship letter. So this is the biggest mistake that the candidate tends to make by themselves when they do the application without a professional help. And that's when the actual need for a professional guidance comes in to
Okay,
rectify and to avoid these mistakes.
understood that. Now, we're speaking about UAE, and we know that UAE is advancing quite massively. Is AI changing recruitment for doctors in the UAE, and how should candidates prepare for this opportunity, doctor?
Absolutely. It's got an excellent shift for that matter. Telemedicine, AI diagnostic proficiency are increasing, which are valued in a very, very great packages. Reflecting on how forward we are looking at this market, my advice to the candidate would be to build a genuine comfort with the AI assisted diagnostic in their specialty, or rather, because it is quickly becoming a differentiator in the competitive field. So anybody with AI specialist, for that matter, AI generative specialist, are really making a good amount of shift in the career.
So, looking ahead over the next 5 to 10 years, where do you see the biggest opportunities for international doctors in the Middle East? Because everyone is a little confused. Should I try UAE, or UAE is highly saturated? Should I look for Saudi? Should I look for Qatar, Kuwait, Bahrain, Oman? So, what do you feel?
So I feel basically, so I see a tremendous opportunity ahead, continued with a strong demand for surgery, radiology, anesthesia, anything with specialists for that matter, oncology. And a meaningful growth is supposed to happen for all of these medical facilities, specialties, particularly elective and fertility related specialties, right? Because they are the genuine career tracks and digital health is also expanding. But if you talk about which emirate for that matter, UAE or other, I would say UAE has been the most developing emirates of all, wherein Dubai and Abu Dhabi have been progressively multiplying into so many progressive opportunities. UAE is always 5 years ahead to what is happening in other emirates.
Thank you. And, doctor, if someone is listening today and wants to build a successful medical career in the UAE, what do you feel are the first three steps that they should take, or they should at least think about it today?
So the first three steps that I would recommend is first things will be choose the emirate and the authority that fits your specialty, goals, and then begin with your documentation and verification immediately. Second, uh, prepare seriously for the licensing exams. Treat it with the respect that the exam deserves. And the third is start building your professional network now so that the licensing and career building moves forward together. So it's an hand-in-hand process.
And, doctor, I just recently came across a doctor who lost DHA all three attempts. So,
Hmm.
what happens next? Can he write to the authority and get another attempt, or he is not eligible at all for any further attempts?
Yes, it is true that UAE gives you three attempts only. So UAE, for that matter, not just DHA. Once you start giving your exams, so in UAE you have only three attempts. But they have also made an exception that if, for example, let's take an example, if you have successfully, if you have not passed your exam, right, the three attempts, you can request for a fourth attempt from another authority. For example, DHA, if you haven't cleared for three attempts, you can ask MOHAP, request MOHAP for a fourth attempt, wherein that will be your final attempt for UAE. And they will, and you might have to complete the whole process again and sit for an exam.
Okay. And because you yourself have done your DHA exam, is the exam doable or is it really difficult? I mean, I'm talking from GP point of view because for specialists, we understand they've done specialty training for 3 years, and after that, they've worked in the same specialty for 3 years. And exam is also specialty specific. So I think for specialists, it's a
Yeah.
easier exam. But for GPs, how is it, doctor? Is it a doable exam?
It is absolutely worth writing the exam. I'm telling you, it is doable exam provided you have a direction as to how it has to be started. So, as I told previously, when I started, there was not much of direction on examining, on data flow, and everything. But as now, when I see you really need a direction, a mentor who can guide you through, and of course, there is a possible direction that can be given to doctors because for GP, you might have to study 20 different subjects as compared to that of specialist, right? So we need to prepare those as per the syllabus that has been given by DHA, which is already provided for GPs, even in Abu Dhabi for that matter, and MOHAP for that matter. So that's the first biggest hurdle that the doctor has to cross is prepare it, master the entire subject wherein you clear the exam. Because unless and until you know how the healthcare system works here, what is exactly been asked, you won't be able to crack it.
So, for all the doctors who are looking for any further guidance, whether it could be preparing for your GP exam or whether it could be for your data flow, Dr. Anjali is available on gocampusworld.com. The link to the web platform is given in the description below. You can book a one on one mentoring session with the doctor if you wish to discuss more in detail and if you need her help and support in understanding the pathway. So, finally, what's that one piece of advice you wish to give for every international doctor who wants to start this journey now?
I would say that yes, changing your career or maybe transitioning your career into a different country is the biggest decision that a doctor can have in his life. But Middle East, for that matter, I can assure that will never disappoint you in the matter of career, in the matter of lifestyle that you would be getting in UAE if you are in UAE.
Mm-hmm.
Job-wise, your career growth, your lifestyle, the salary expectations. Well, I would say like a possible direction if it's been given to a doctor, and a doctor who thrives, you're the one who approaches it with the real intention. So you have to have your wholehearted intention when you start something, and I'm pretty sure UAE is all ready to not upset you in your career goals.
So, doctor, before we close, how is the
Yeah.
work life balance? Because largely when we meet doctors, they move to Australia, New Zealand for mostly work life balance. How
Yeah.
is it in UAE?
It's similar. So even in hospitals, even in clinics for that matter, there are schedules that doctors follow. So there are shifts every time. So there is a rule that you follow. So you work for 8 hours for 6 weeks, 6 days in a week for 8 hours per day. And that's how
Mm-hmm.
you fill in 48 hours a week. So that's the rule that you have to follow. And then one day there's an off. So it's the UAE labor law that every hospital and clinic has been following. So that is why I always tell when you look for jobs, you look for the things that really matters, the job timing, the amount of hours that you are working for, because UAE is very strict about the labor law here. So everybody has to follow it. It's just 48 hours a week and one day off.
Thank you so much for your time, and it was wonderful talking to you. And as I said to our audience who are listening to this podcast, if you really want to talk to Doctor one on one, the link is given in the description below. And thank you so much for your time, Doctor.
Thank you so much. Thank you so much to having me.